I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We're coming to you from the American Academy of Developmental Medicine and Dentistry conference in Denver, Colorado. And I have two wonderful guests today. Dr. Dion Chin Kit Wells, dentist, and Elizabeth Thompson, occupational therapist, right?
That's correct.
Excellent. Okay. I can't wait to share with everyone what you're doing together in the field of providing dental care for people with intellectual and developmental disabilities. So which one of you wants to go first? How about you go first?
Sure. Thank you. Thank you so much for having us, first of all. So I am a dentist, yes, but also a pediatric dentist, and I treat patients with disabilities. I teach at the dental school and at the residency program. We see quite a large number of patients with intellectual and developmental disabilities, and we want to optimize the care that we provide. And what we found is that working with occupational therapy can allow us to do that in a much unique way, but it is, I think we might be the only practice that has a full-time occupational therapist that I can't wait for you to meet, Elizabeth Thompson.
All right, Elizabeth.
Hi, my name's Elizabeth, as you introduced me. So I'm so excited to be part of dental medicine with Dr. Dion and other attendings and pediatric dental residents. And basically what I'm providing is a little bit of getting to know the patient. So I do a lot of pre-visit interviews with caregivers, if not the patients, to find out information before they actually come into the dental office, finding about their history, dental history, any kind of health concerns, any precautions, and a bit of a patient description. So we know who they are. So what do they love? What are their interests? Understanding communication, physical abilities, cognitive and sensory processing, as well as behavior emotional regulation, kind of concerns, strengths, needs that they might have so that we can actually optimize care in the dental office. And then I work chairside with the dental team to be able to support the patient throughout appointments and providing care between appointments as well to help them to be able to gain skills so that future appointments can get better, but also improving oral hygiene at home is a big thing.
So do you see the person together sometimes as well?
Yes, we do. Elizabeth can be chairside, or there are students, OT students, that rotate through as well. And so whether she's chairside with me or with the dental hygienist or pediatric dental residents, she can be right there with us chairside, if you want to elaborate on that.
Yeah, so basically we're there as like a limb, I feel. So if the dentist is trying to do something or the hygienist, we're there just to support, to be able to hopefully make it easier or better. So maybe an example would be, I see that the hygienist is ready to scale the patient's teeth, and they're only successful scaling a couple teeth. And I think of a strategy to help, enable the patient to be able to tolerate having more teeth scaled. So teeth was scaled, I understand their cognitive abilities, and I communicate to the patient, how about we try 5 teeth? And I determine a strategy kind of in sync with the hygienist and patient to be able to enable that to be a bit more improved.
So are there some physical support type things that you might put in place as well too that can help the person tolerate or participate in the procedure better?
Yeah, absolutely. So sometimes it might be cushions that we might use just to be able to make sure that the patient is positioned better. Or we might choose to actually decide not to have the patient transfer into the dental chair and work with them in an alternative chair or a wheelchair if that is their mode of transportation.
So you mentioned maybe 2 teeth and maybe you can get to 5 teeth. And I think that's a concept I've heard you talk about before, about we don't have to do it all in one sitting, right?
Absolutely. And I mean, of course, as dentists, we want to fix everything, right? Especially the chief complaint. But really, we have to take a look at what the patient can handle that day and if we need to do more, We have occupational therapy to help, or we may set up a couple of appointments and gradually get the patient to what is needed. The whole idea is to optimize the care and to not have to take every patient to the operating room to complete the treatment that's needed. A lot more can be done in the clinic if you have the support and staff, if you're collaborating, if you're taking the time to get to know that patient. And of course, there are situations where we still have to go through sedation. Elizabeth and OT have even been there to support and to pattern those patients for sedation appointments where we might need to do more.
Yeah, so for example, with sedation, a lot of times the patients have never been down there. They don't know what to expect. So that might be preparing them with social narratives or task strips, exposing them to some items they actually might see. So they oftentimes need IVs. So I do desensitization so that they know what to expect, how to be prepared for that, visiting down to sedation clinics so they can see it and doing tours.
Can you elaborate more on desensitization, if I can say it, and what that might look like?
So it is different for every patient. Oftentimes with desensitization, it's slow exposure to a component that they have to learn to tolerate. So if, for example, they're getting an X-ray, it might be exposure just to seeing the equipment and where they might have to sit or stand, and then the items that need to go into their mouth. And this might occur over numerous appointments. And then for some patients, they can have just one moment of exposure to all of the steps. And that's enough for them to be able to go into the appointment and participate. I think of a patient that we recently had and presented on, and that was Miracle, actually. And she was having a number of procedures completed, and she had a lot of dental anxiety. And so I did exposure with her to each step of the procedure so she could see the actual instruments that the dentist is going to use. And I could speak to her also about the sensations that she would also be experiencing. So that is all part of desensitization.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. And that's similar for all of us. I mean, when we're more comfortable in an environment, we'll likely be more comfortable with whatever is happening in that environment and the procedures that might need to be done as well.
And I really wanted to touch on that because it is also desensitizing us, the providers, from front desk go all the way back to in the clinic itself in treating patients with disabilities, even just in greeting them. So Elizabeth and the OT team will also provide education to us, to the providers, to the front desk, to the staff, so that we have a better understanding of how to communicate from a point of compassion, how to understand what we're seeing, what terms and words to use, what body language. And that has been very, very beneficial. So the desensitization not only goes to the patient and to the patient parent, but also to us as well. And remember, dental students are watching and learning, residents and watching and learning as well too.
That was my next topic I was going to bring up. It's like, it's wonderful that you two are doing this, but what's even better is you're teaching others how to do this, which is fantastic, because we know that there's a need for education of healthcare providers, dental providers of all types, to understand the nuances of providing healthcare to people with intellectual and developmental disabilities, so we can all work towards health equity for everyone. Yeah. Great. So I want to ask something on a little bit different topic. So we are here at the AADMD conference, and you have some involvement in the AADMD, don't you?
Just a little bit, I guess. So I am the president-elect of the AADMD. Very, thank you. Very, very honored to be that. I will be the first woman and the first person of color, but most important, I'm boots on the ground. And I think, that is what the AADMD is all about. This is no one's full-time job. This is us who have such a care and concern for advocacy, education, and optimize best clinical care for patients with disabilities, and to assure that everyone else out there is feeling and doing the same thing. And so, it's a good spot for me because I'm allowed to be authentic and be myself, a person who comes from, leading and teaching from the heart. So I'm going to do the best that I can with this position, but it really is doing a lot for me as well, too. And in doing that, it's a lot for my community and for the community out there of those with disabilities.
Well, it's wonderful that you're doing that, and it's very clear that what both of you do comes from the heart. There's no doubt about it. So there's something I like to do. I call it 3 in 3. So it's 3 things in 3 minutes that you would tell our listeners about, or maybe advice, words of wisdom that people can implement in their own lives that can improve the world for people with intellectual and developmental disabilities. So Elizabeth, how about you go first?
Good.
3 tips.
I guess one tip is you can have head knowledge, and that's really important. But take the plunge and expose yourself to the patient population. And even if you're afraid, it's okay. Acknowledge your emotions, but just jump in and, that head knowledge will come and you'll feel more comfortable when actually working with the patient. So the more you actually interact with your patients, the more comfortable you'll feel. And then you'll be able to apply all that head knowledge. And so that's one thing that I think that's really important and keeps people back. They're afraid. The second is, and it's probably what Dr. Dion's going to say is, who knows though, is speak to your patient and listen to them, right? And even if they can't use their words, they're still going to communicate to you. And don't always listen to the parent that says, oh, my child's nonverbal. They can't communicate. They can. I guarantee it. So do that, is listening. And then the third is always, listen to the parent and the patient and consider them the expert, because they're living every day with the member of their family and they know them best, right? And if we don't count them as the expert, we run the risk of not being able to build a good relationship and being able to help our patient in the way that they need help.
Those are excellent thoughts, excellent tips. Your turn.
I should have gone first.
You see? Pluses and minuses to everything.
No. So the first would be to come from a place of humility. Remember that at any moment, you can be that person with a disability. And so for me, I never want to graduate dental students. I want to graduate humanitarians. And that's not easy to do in the 4 years of dental school, but it is something that I work really hard at doing. If you enter that clinical space from a place of humility, the experience for that patient and for yourself is going to be so much more valuable than just going in as the dentist. Second of all, let me see. Yes, definitely get to know your patients. It really is disappointing when you don't take the time to talk to these patients and generalize what they look like or sound like or where they may come from. And you miss that opportunity to really get to know somebody who might be a pianist or, reading the same book that you're reading. So take the time to find something in common. And it doesn't take away from the appointment. You could be setting up and talking and looking at them and talking as you're moving things around, but don't miss out on that opportunity. And third, have fun. If you're having fun, they're going to have fun too, and you're just going to go to bed just so much easier, have a good night rest if you come into work to have fun. And I'm not saying be so silly that you're not doing the right thing, of course, right? Don't take this the right way, but certainly be silly and have fun, whether it be a pediatric patient or an adult patient. Just like animals, when you're laying back in that dental chair, you can sense what that person around you is feeling. They're going to be able to tell if you have a hard day or had a bad day yesterday or last night or whatsoever. So take time to take care of yourself so that you can come into your workspace and have fun while you're there.
I love that. Have fun really in everything we do, right? Life is full of challenges. Let's find the best ways to enjoy it. And we can do that in anything. Look, thank you both so much for being here today. More importantly, thank you so much for the work that you're doing in this field. Congratulations again on the presidency. And we'll do this again another time because we want updates on what's happening.
Sounds
Thank
good.
you.
Thank you.
Thank you so much.